Never give up. Great things take time. So be patient. Yes, all the successes that appear to us that have happened overnight are actually not overnight successes. They have taken a lot of effort, lot of love, lot of patience, lot of perseverance. Yes, so even if today you are not able to finish whatever timetable you have made for today, don't give up. Think sincerely where you have made a mistake. Have you overestimated what you can do in a day, or have you not utilized the time very well? Yes, if you look at it sincerely, if you monitor yourself, your progress sincerely every day, every power is there inside you. You will be able to find out where you are wrong and how you can correct it. You do not need to rely on anybody. The power is inside you. Find that power. Don't give up. Keep a constant track. You can do everything. So with that, we start with the nerve supply of the ear. Now, why is the nerve supply of the ear important? Yes, can you tell me if there is any condition of the inner ear, can there be pain in the ear or not? Or in other words, here is a patient who has come to us with a complaint of pain in the ear. So do we think of any inner ear pathology in this patient? Can conditions of inner ear lead to pain? Never. In the inner ear, we do not have any sensory nerves. We have the nerve for hearing, we have the nerve for balance, but we do not have the sensory nerve. Sensory supply is not there. So conditions of inner ear never lead to pain. So if there is any patient who has come to us with a complaint of pain in the ear, we have localized that it is either the external ear or it is the middle ear. We can just examine and we can find out. But many of the times, patient complains of pain in the ear and actually there is nothing in the ear. Ear is perfectly normal. Why so? Yes, because the ear is supplied by so many nerves, and these nerves supply not only the ear, they supply other parts of the body also. So whenever there is any infection, any tumor of those areas, pain gets referred to the ear. So whenever a patient has come to the OPD with a complaint of pain in the ear and you are actually not finding anything in the ear, so where all you have to look for to rule out a condition in that area? Again, we need to know. Yes, there was this patient who had come to me with a complaint that I have pain in the ear and there was a furuncle in the ear. So I told him there is a furuncle in the ear and I wrote down the medicine, but he was adamant that please check my throat. Please check my throat. I asked him, okay, I'll check it, but you have any problem in the throat? No, I am a smoker. My father was a smoker also, and he died of cancer of the throat. And the only complaint that he had for a very long time was just pain in the ear. And we just ignored it, and later on the doctor told that pain in the ear was because of the cancer, and had we recognized that earlier, then maybe he would have been saved. It would have been an early disease where he would have been diagnosed. So now he is very cautious about any pain in the ear. Any pain in the ear, immediately he has to show. Why? Because that can be cancer. So we need to know which nerves supply the ear. We need to know that from which all areas pain can be referred to the ear. And yes, these are the questions that are asked very, very commonly in your exams. Almost every year or every second year, there is a question from this topic. So let us start with the nerve supply of the pinna first. Now, in the nerve supply of the pinna, what we need to know is that the pinna is supplied by many nerves. To be exact, 5 nerves. Yes, from where are all these nerves coming into the pinna? Why are they coming to the pinna? Pinna develops from where? It develops from first and second arch. Yes, those are the hillocks of his. So ultimately they fuse to form a single cartilage. So once the cartilaginous framework of the pinna has formed, the skin that covers it, that comes to cover it, comes from where? It comes from the adjacent areas, from the adjoining areas. So the skin to cover the anterior part will come from anteriorly, to cover the inferior part, and the posterior part will come from here. Yes. So along with coming to cover the pinna, these parts of the skin, they also bring the nerve supply. So whichever part is covered by which area's skin, the nerve supply is the same. So when you know this, it will be very easy for you to remember what the nerve supply of the pinna is. So what will be the nerve supply of the pinna anteriorly? Yes, this area, the skin comes from where? Just from the face. So what is the nerve supply of this area of the face? What is the nerve supply here? This will be the same nerve that will be supplying this anterior part of the pinna. Anterior part of the pinna, when I talk about anterior part of the pinna, what is that part of the pinna that I am talking about? I am talking about the tragus, and I am talking about the ascending crus of the helix. Ascending crus of helix, little part of the anterior part of the helix. So that will be supplied by which nerve? Yes, which is the nerve that is supplying here? We know all the face is supplied by the trigeminal nerve. So which branch of trigeminal? The mandibular. Yes, and exactly, can you tell me which branch of mandibular? Which branch of mandibular gives a sensation to this part? Yes, the auriculotemporal, the auriculotemporal nerve. Now, if I am talking about this area, posterior part, so what will that be supplied by? Yes, all the nerves here are coming from the cervical plexus. The skin here comes from behind. So along with that carries the nerves of the cervical plexus, the C2 and the C3. Yes, C2 and C3. So the C2 branch, only the C2 branch is what is known as lesser occipital. Lesser occipital. Yes. So lesser occipital, as the name, is supplying lesser part of the pinna. So it supplies only a small part of the pinna posteriorly. Yes. So it supplies small part of the pinna posteriorly. Whereas C2 and C3 is what is known as greater auricular. Greater auricular. So as the name greater auricular, it is supplying the greater part of the pinna. From where does it come? Greater auricular is a very, very important nerve. Yes, why very important nerve? Yes, whenever is asked the nerve supply of the face, which is a very common question in your exam, it is only two areas are asked. Okay, one is the tip of nose and the other is the angle of mandible. Yes, and if you remember like this, how do you remember usually the nerve supply of the face? Yes, okay, ophthalmic, maxillary, mandibular, like this. So if you remember like this, ophthalmic, maxillary. Okay, tip of nose, that is supplied by maxillary. Correct? Incorrect? Incorrect. Okay, ophthalmic, maxillary, mandibular. Angle of jaw, angle of mandible, mandibular. Yes, no? Incorrect. This is by greater auricular. So here we do not have to remember like this. How do we have to remember then? We have to remember like this. It is like this: ophthalmic, and then is maxillary, and then is mandibular. Can you see in this picture how it is? So it is ophthalmic, it is coming from here. Yes, it is vertical. It is ophthalmic, and then is maxillary, and then is mandibular. Mandibular supplies the whole of the mandible area except for the angle of jaw. Angle of jaw has been a repeated question. Angle of jaw, this is known as the shaving area. Angle of jaw area. This is supplied by the greater auricular. So how does the greater auricular come? It is a branch of C2, C3. So from the C2, C3, it comes like this. Supplying the angle of jaw, it goes to supply greater auricular. Name itself as auricular means auricle, pinna, and greater part of auricle it is supplying. So just see here how it supplies. So it comes from posteriorly. It will come from posteriorly like this, C2, C3. It will go to supply the angle of mandible, and then it will go to supply most of the lateral surface as well as most of the medial surface of the pinna. That is the greater auricular. So if we are seeing in this picture, we are seeing very clearly what nerves are supplying which area. So yes, we are able to see the anterior part which is coming from the face. This is the auriculotemporal nerve. The major part of the pinna, this is the greater auricular, all this marked in blue. This is the greater part of the pinna supplied by the greater auricular. And another nerve that supplies the pinna is this here is the concha area. Yes, the concha area is supplied by the vagus, the auricular branch of vagus. Auricular branch of vagus is coming from where? Where is the vagus nerve in relation to the ear? Yes, tell me, where is the vagus nerve in relation to the ear? Yes, very good. In the floor of middle ear. Yes, I told you floor of middle ear is a very, very important wall of the middle ear. The floor of the middle ear somewhere here. Can you see this? It is in relation to what? Yes, it is in relation to mainly the jugular bulb, and yes, we can see the carotid which is going quite anteriorly. So it is in relation to the anterior wall of the middle ear. Along with the jugular bulb, we have the nerves 9th, 10th, 11th cranial nerves. So we have the 10th nerve here, the vagus nerve here. Does the 9th nerve also give some sensory branch? Yes or no? Yes, the 9th nerve gives a sensory branch to where? Yes, we'll do that in some time. Yes, before that, what we are doing is the 10th nerve. So the 10th nerve, yes, it also gives a sensory branch to the ear. That is known as the auricular branch of vagus. And what it does is, from here, floor of middle ear, we have the vagus nerve. So this vagus nerve, it travels all through the external auditory canal, supplying the floor and the posterior wall of the external auditory canal. That again we'll see in some time when we do the nerve supply of external auditory canal. And then it comes here up till the concha to supply the concha. So this area is supplied by the vagus, and along with vagus, a very small part posterior superiorly. Now if I ask you, show me the posterior superior part of your external acoustic meatus. So this is the meatus, yes. Which is the posterior superior part? Here, posterior and superiorly. This part, a small part, is also supplied by the facial. So this facial accompanies the vagus. Along with the vagus, it goes and supplies. We know where the facial is, right? We know that the facial nerve, it has a vertical segment where it goes down to exit through the stylomastoid foramen. So the vertical segment of the facial nerve gives a auricular branch, a posterior auricular branch, and that gives a sensation, a very small part, to the area of the concha, posterior superior part of the meatus, external acoustic meatus. So this part is supplied by the auricular branch of vagus, and the facial nerve supplies posterior superior. Posterior superior part of external acoustic meatus and adjacent part of canal of external auditory canal. Okay, now the auricular branch of vagus has been given a separate name. The auricular branch of vagus is also known as Arnold's nerve. It is known as Arnold's, or it is known as Alderman's. It is known as Arnold's nerve, or it is known as Alderman's nerve. Yes, why it is known as Alderman's nerve? Yes, Alderman were soldiers of certain country. What they used to do is, before going for any party, they used to put spirit in the ear to stimulate the vagus nerve. What will happen if the vagus will get stimulated? What? Vomiting. You want to vomit before the party? No, think of something better. Yes, that will stimulate the appetite. Yes, so 4 days quota you can have in 1 day. Till now, all our parties have got wasted. Yes, next time before going for any party, don't forget to put spirit. Where? Here? Here. Yes, in the ear. Yes, to stimulate which nerve? Vagus, to stimulate your appetite. Yes. So how are we going to remember which nerves supply the pinna? To summarize the nerve supply of the pinna, we have to remember is supplied by Goa. Goa. Okay. G-O-A-A. What is G-O-A-A? What is G? G is greater auricular. That is C2, C3. O is lesser occipital. That is C2. 1A is the auriculotemporal nerve, the branch of mandibular, and another A is the Arnold's or the Alderman's or the auricular branch of vagus. So this is the auricular branch of vagus, and along with it a small part is supplied by the facial. So we are seeing that 5 nerves, 1, 2, 3, 4, 5, they supply the pinna. Yes. So now what we know is the nerve supply of the pinna. So if there is any involvement of the tragus, there is pain in the ear. This was a question that was asked in the exam. This pain is because of which nerve? Tell me which nerve. You will tell me. So the moment it is tragus, you know tragus, from where is the nerve supply coming? From this face here. What is that? That is the auriculotemporal nerve. Okay, now if you are doing a lobuloplasty, lobuloplasty means that the hole of where the earring is worn has completely gone torn. So you repair it. So that is what is lobuloplasty. So you are anesthetizing this area of the lobule. So which nerve are you going to anesthetize? So which nerve supplies this area? Yes, all this area from below here. Yes, from the angle of mandible till here, all this lateral part, all this area of the medial part that we already saw when we saw here, all the lateral as well as the medial part, all this is supplied by the greater auricular. So if we want to do a lobuloplasty, or if a cut has been given, the pinna has got cut from here and the patient is having pain. So this is because of which nerve? It is because of the greater auricular nerve. So again, what we need to remember here is, which was a recent question, just see here. Now this patient is undergoing a parotidectomy, and the incision for parotidectomy, just note it is from in front of the pinna, it goes behind and it is like a lazy S. Now when you are giving the incision here, we know that which nerve is coming from here behind. Yes, from here is coming the greater auricular, supplying the angle of the mandible. It is going to supply the most of the lateral as well as the medial surface of the pinna. So it is but understood that when you are giving this incision, this greater auricular nerve, it lies very superficially just below the skin. There are high chances of injuring this nerve during parotidiectomy. So what will happen following parotidiectomy? If you have injured this nerve, what will happen? Yes, if you have injured this nerve, there will be anesthesia in this area of the angle of mandible. What did I tell you? This area is known as the shaving area, or there will be anesthesia over the lobule, and this is what you have to inform the patient preoperatively, that in the shaving area there will be anesthesia following the surgery, or in the lobule, all the females you need to inform that in the lobule area there will be anesthesia following surgery. So this was the question that was asked in your exam, that following parotidiectomy patient experiences anesthesia in the area of the shaving area. So this is because of injury to which nerve? Injury to, yes, to the greater auricular nerve. So this injury will lead to anesthesia in the shaving area and also in the lobule. Okay, now just tell me that auriculotemporal nerve is supplying not only the anterior part of the pinna but this whole auriculotemporal nerve. It is supplying all this area. Yes. So if the patient is complaining of pain here in the tragus area, and when you are examining the ear, what you see is that everything in the ear is appearing perfectly normal. So where all will you look for to find out the site, the pathology, the site of the lesion, which might be referring the pain to the ear? So pain in the ear can be a referred pain very commonly, as I told you. It can be primary otalgia or primary pain of the ear because of condition of the ear, or it can be a referred pain. So where all will you look for? If the patient is complaining of pain in the tragal area, where will you look for? Yes, now see very carefully all this. If you just understand it, you remember this picture, you will not have to rectify. So this is supplying the TM joint. Yes, the mandible. When I say mandible, what do I mean? Teeth, dental conditions, dental conditions. Yes, and the tongue, anterior 2/3 of the tongue is again supplied by the mandibular. So anterior 2/3 of tongue. So if there is any lesion of this area, TM joint, or in the teeth, dental conditions, anterior 2/3 of the tongue. What? Anterior 2/3 of the tongue is chorda tympani? We are not talking about the taste. We are talking about the general sensation. Sensation is not by chorda tympani. Sensation is by the branch of mandibular, lingual. Yes. So if there is involvement of any of these areas, pain can be referred to the ear, to this part of the ear, through the auriculotemporal nerve. Yes. So here, through the auriculotemporal nerve, there can be referred pain from TM joint, from teeth, and, or I can just mark it as 1, 2 and 3. Yes, so from 1, 2 and 3. Referred pain from 1, 2 and 3. So I have told you auriculotemporal. You tell me vagus. Vagus supplies which part of the ear? Yes, it supplies which part of the pinna? It supplies the concha of the pinna. Yes, so from vagus, if the pain is getting referred, if the patient is having pain in this conchal area and ear is perfectly normal, so from where can pain be referred to the ear? So vagus supplies which parts, which other parts of the body? Vagus. The name itself tells you the branches of vagus. What are the branches of vagus? The laryngeal nerves, the recurrent laryngeal, the superior laryngeal. The name itself tells you laryngeal means they are supplying the larynx. So yes, in tumors of the larynx, in carcinomas of the larynx, the thyroid, tumors of the thyroid, in all these conditions, pain can be referred to the ear through the vagus. Yes, so vagus pain can be referred through the larynx to the thyroid. Yes, and we are left with the facial nerve. Facial, in which condition can patient have referred pain to the ear? Through facial nerve without any involvement of the ear? Yes, in acoustic neuroma. Acoustic neuroma is a tumor that arises from the internal acoustic meatus. So in the internal acoustic meatus, we have the 8th and we have the 7th nerve. So there the compression of the 7th nerve can lead to pain, hyperesthesia. It leads to, in fact, hyperesthesia in this area that is supplied by the fascia. So can you exactly tell me hyperesthesia in which part of the ear? Yes, posterior part of the external acoustic meatus. And this sign of hyperesthesia of the part of the fascia supplied by the facial of the ear in patient of acoustic neuroma is what is known as the Hitzlsperger sign. Hitzlsperger sign. So what is this Hitzlsperger sign? This is hypoesthesia of part of ear, that is the posterior part, supplied by facial. Supplied by facial. Yes. So quickly, to summarize, tell me what is the nerve supply of the pinna is. Nerve supply of the pinna. Yes, nerve supply of the pinna is Goa. Goa. What is Goa? G-O-A-A. G is greatoauricular. O is lesser occipital. A is auriculotemporal. And another A is auricular branch of vagus along with facial. Okay, now I will show you the part of the pinna and you will tell me that pain, the nerve supply of that part of the pinna. Yes, tell me here. Yes, what is this? Tragus. Tragus is supplied by. Yes, immediately that picture should come to your mind. Yes, the auriculotemporal. Okay, lobule. Lobule. This is supplied by. Yes, this is supplied by the greater auricular. Yes, the posterior part, a small posterior part of the pinna. Yes, by the lesser occipital. Otherwise, most of the pinna, laterally as well as medially, is by the greater auricular. Yes, this concha. Concha, tell me, it is supplied by which nerve? Yes, the vagus nerve. What is the auricular branch of vagus known as? Arnold's. It is also known as Alderman's. Yes, the patient is having hyperesthesia in this part here, posterior part of the external acoustic meatus. You have to rule out which condition? Acoustic neuroma. What is the sign known as? This is known as Hitzlsperger sign. So we know what the nerve supply of the pinna is. We know from where all pain can be referred to the pinna, from which other areas. Yes, quickly tell me, if there is a TM joint synovitis and the patient is having pain in the ear, it is referred through which nerve? Through which nerve? Auriculotemporal nerve. In a patient of dental conditions, pain is referred to the ear through auriculotemporal. In a patient of parotid tumor, parotitis, pain is referred to the ear through. Yes, again this area. What is that? Yes, again the auriculotemporal. In a patient of ulcer or carcinoma of the anterior two-third of the tongue, pain is referred to the ear through. Again, auriculotemporal. In a patient of cervical spondylitis, pain is referred to the ear through. Cervical spondylitis means, yes, C2, C3. So, again, pain will be referred to the ear through C2, C3, that is the greater auricular and the lesser occipital. Yes, so in cervical spondylitis, pain will be referred pain through C2, C3. C2, C3. Yes, so I will make a table for you in the end also, so that everything gets summarized at one place. Yes, but before that, you are going to understand this. So now coming to the nerve supply of the external auditory canal. So nerve supply of external auditory canal. What is the nerve supply of the external auditory canal? The last two A's of the Goa. So pinna is by Goa. Pinna is by Goa. And a small part by the facial. Yes, so these last two A's of the Goa, the auriculotemporal and the auricular branch of vagus, the two A's, yes, they come to supply the external auditory canal. So external auditory canal is supplied by the two A's. What are the two A's? Auriculotemporal nerve and the auricular branch of vagus, that is the Arnold's. Arnold's. We already saw that the vagus from the floor comes to supply the meatus, the concha. So this does not only come to supply only that specific part of the pinna, the concha. It gives a supply to whole of the floor and the posterior part. So the Arnold's supplies the posterior and the floor of the EAC. So what is left? Anterior and the roof, that is supplied by auriculotemporal. So this auriculotemporal does not supply only this part of the tragus and the anterior part of the pinna. It goes inside also to supply the external auditory canal. Again, the anterior wall and the roof. So this supplies the anterior wall and the roof plus roof of EAC. And Now coming to the tympanic membrane, what supplies the external auditory canal? The 2As, that only supplies the lateral surface of tympanic membrane. So lateral surface of tympanic membrane is again supplied by the 2As. So the tympanic membrane is supplied by again the 2As, that is the auriculotemporal nerve and the Arnold's. Whereas the medial surface of the tympanic membrane, what is the medial surface of the tympanic membrane supplied by? You already know that. What is the nerve supply of the middle ear? Yes, we know that in the floor of the middle ear, we have the 9th, 10th, 11th cranial nerves. The 9th nerve from the floor gives a branch. Tell me the name of that branch. Yes, the branch of glossopharyngeal, Jacobson's nerve. It comes to supply from tympanic plexus on promontory. We already know that. That from the floor comes the tympanic plexus, comes the Jacobson's nerve to form tympanic plexus on the promontory, and that gives the sensory supply to the inner surface or the medial surface of the tympanic membrane. So this tympanic membrane lateral surface is supplied by auriculotemporal and Arnold's, whereas the medial surface is supplied by the Jacobson's nerve. Jacobson's, that is a branch of the glossopharyngeal. The 9th nerve, the glossopharyngeal. Yes. So what we are seeing is that the glossopharyngeal supplies the middle ear, it supplies the medial surface of the tympanic membrane, and glossopharyngeal supplies many other areas. Can you tell me glossopharyngeal supplies what? Yes, glossopharyngeal, when it is coming down from the base of skull, it gives a supply to the part of the it supplies the oropharynx. What is the oropharynx? It is just behind the oral cavity, which means if I just show you this image, this is what is the oropharynx. So what is the oropharynx? It is the posterior 1/3 of the tongue. Posterior 1/3 of the tongue. It is the tonsils. It is the soft palate. Soft palate. All this is the oropharynx, and the nerve supply of the oropharynx is the 9th nerve, the glossopharyngeal. So whenever any patient has a carcinoma of the base of tongue. Base of tongue is posterior 1/3 of the tongue. Whenever a patient has acute tonsillitis, tumors of the tonsil, whenever the patient has ulcer over the posterior 1/3 of the tongue, over the soft palate, in all these conditions there can be pain in the ear. Through which nerve? Through the glossopharyngeal nerve, and these are questions asked in your exam. So now let me ask you here, this is a picture that is given to you and is marked that the patient has a big ulcer on the anterior 2/3 of the tongue. Pain will be referred to the ear through which nerve? Yes, okay. Patient has a big ulcer or a tumor of the base of tongue, posterior 1/3 of the tongue. Now pain will be referred to the ear through. In both the cases, pain will be referred to the ear, but through different nerve. Here, if the pain is getting referred, it will be through the mandibular branch. Yes, the auriculotemporal, and here if it is going, it will go through the glossopharyngeal. Through the glossopharyngeal, the Jacobson's nerve. Okay. So before we fill this table, you are going to quickly tell me the nerve supply of the pinna. Yes, nerve supply of pinna is Goa. Very good. Nerve supply of external auditory canal is the last two A's, auriculotemporal, auricular branch of vagus. Okay, what is the nerve supply of the tympanic membrane? Lateral surface. Again, it is the two A's, the same that supply the external auditory canal. The medial surface is by glossopharyngeal. What is the nerve supply of the middle ear? Again, the glossopharyngeal. What's the nerve supply of the inner ear? No sensory nerves? No. So, can there be pain in the ear because of involvement of inner ear? No. Because of middle ear? Yes or no? Which nerve? 9th nerve. Because of involvement of tympanic membrane? Yes or no? Yes. Which nerve? Medial surface? 9th. Lateral surface? The two A's. Yes. Of the external auditory canal? Yes, the two A's. Patient has pain over the tragus? Which nerve? Auriculotemporal. Lobuloplasty? Which nerve is anesthetized? Yes, the greater auricular. Angle of joy supplied by greater auricular. Following parotidiectomy, anesthesia of the lobule is because of injury to which nerve? Greater auricular. Anesthesia of the over the shaving area is because of which nerve? Yes, again it is greater auricular. In a patient of TM joint synovitis, pain in the ear is because of, yes, auriculotemporal. In a patient of carcinoma base of tongue, pain in the ear is because of 9th nerve. In a patient of carcinoma of the anterior 2/3 of the tongue, pain in the ear is because of, yes, the auriculotemporal, the mandibular nerve. In dental conditions, in parotitis, in parotid tumors, pain in the ear because of auriculotemporal. In cervical spondylitis, pain in the ear because of C2, C3. Yes, so let's summarize that here. So in TM joint, dental conditions, parotid infection, yes, tell me the nerve. What is this? This is the auriculotemporal nerve. Tonsillitis, peritonsillar abscess, carcinoma base of tongue, these are questions almost every year. Yes, all this is the oropharynx. So here the pain will be because of the ninth nerve, glossopharyngeal nerve. Tell me the name. The tympanic segment of glossopharyngeal, that is known as Jacobson's. Carcinoma larynx, yes, that is the 10th nerve. What is the name of the 10th nerve? Yes, that is Arnold's. The auricular branch is known as Arnold, or it is known as Alderman, Has been a repeated question in your exam. While cleaning the ear, patient usually coughs. Yes, you can also do that. Put a bud in the ear and try to clean. See if you cough or not. Also, during syringing, patient usually coughs. Yes, when we clean the ear, patient usually coughs. So this is because of stimulation of which nerve? Cough is what? Larynx, huh? So that is which nerve? Yes, the 10th nerve, the vagus. Which branch? The auricular branch, Arnold's or Alderman's nerve. In cervical spine degenerative conditions, there is pain in the ear because of? Yes, because of C2, C3. C2, C3, that is lesser occipital and greater auricular. And if there is Hystalberger sign, what is Hystalberger sign? Hyposthesia in the part, posterior part supplied by the facial, that is seen in acoustic neuroma. This is because of which nerve? This is because of facial nerve. And the sensory branch of facial is known as, this you must be knowing. Sensory branch, the facial is mainly a motor nerve or sensory. Is it a mixed nerve? Facial is a mixed nerve. It has both sensory and motor parts. The motor is the main. We know facial supplies the facial muscles. Sensory part is a very small part, and that has been given a separate name. That is what is known as nervus intermedius, or it is known as nerve of Risberg. This is not only the sensory part but also the parasympathetic part of the facial, and this we'll do in great detail when we do the anatomy of the facial nerve. Yes, for now you can just remember the name of the sensory branches and where all they supply, from where all can there be primary pain in the ear, that is known as primary otalgia, or from where all there can be referred pain in the ear, that is referred otalgia. So I hope you have understood all this. You now remember all this. The moment you see the pinna, you can see the skin coming from all around, and you can see which nerves are supplying, from where all pain can come. Nothing to rectify in that. The skin from here is coming, the nerve from here is coming, pain from here only will come. Skin from here is coming, pain from here only will come. Yes, so from larynx where it is vagus, from oropharynx where it is glossopharyngeal, so nothing to rectify in that, and I'm sure you'll be able to answer all the questions.